Hello, and welcome to this podcast, Technology, Older People and eHealth. We have three speakers today. The first speaker is Professor Gerry Leavey from Ulster University, who's the director of the Place EE project. He will be followed by Colette Leeson from Digital NI Enabling Programme, and our third speaker is Sylvia McCarthy from Age Friendly Ireland. So Professor Leavey will speak first.
My name is Gerry Leavey, and I'm the director of the Bamford Centre at Ulster University, and we are the lead on the Place EE project. So, what's it all about? Well, Place EE is a transnational partnership of public health agencies, local authorities, academics, and information and communication technology experts, and all engaged in improving the quality of life for older people. The project's been funded by the Northern Periphery and Arctic Programme of the European Union to a tune of €1.7 million. So it's a big project and lasting 3 years. And our aim was to develop and implement locally derived sustainable solutions to encourage internet use and person-centered e-health. And here are all the people who are involved with us, all the institutions. So again, with us as the lead partner and the Public Health Agency in Northern Ireland, Fermanagh and Omagh District Council, Skellefteå Commune, Limerick City and County Council, and if I can pronounce it rightly, Fjarðabyggð in Iceland. So why did we do it? Well, social exclusion and loneliness have significant negative impacts on physical and mental health. Such problems are increasingly prevalent in remote and sparsely populated regions of Europe. The lives of older citizens are further complicated by growing health and social care needs. And some of the characteristics of these rural and isolated places are an economic disinvestment, a flow of young people outside of these regions, and a very common but growing problem is limited and expensive transport, loneliness, as we've said, and a vulnerability to health problems. But on top of that, you've also got absent and hard to reach services. So the regions taking part were Iceland, Northern Ireland, Republic of Ireland, and Sweden. And there you can see the various relative populations and percentages of older people in each of these areas. First of all, creating community coalitions in 4 demonstrator areas. And we used an arts-based activity approach. We engaged schools and students, young people aged generally 13, 14 years. We had knowledge exchange between these older and younger citizens in the intergenerational workshops. So we organized a hackathon, and for those people who don't know what a hackathon is, it was a new term for me. It's where a bunch of tech-savvy individuals and groups get together and come up with solutions, technological solutions for a particular problem. And we developed collaboration between small to medium enterprises, the university and the public health. And ultimately, we're hoping to archive a digital cultural heritage material. What we asked for was about the challenges and concerns, and we did this within workshops with older people. And many of them talked about the loss and disconnection in older age from family and friends, the disconnection certainly from younger people, and often feeling left out, socially excluded, and the general lack of opportunity for social activities. And again, as we alluded to earlier on, the limited transport. Great loss in local buses, the fear of driving in older age, or in fact, having no car at all. And this increases the sense of loneliness and isolation in these areas. But there were other problems too, of course, and the access to health and other services such as GP consultations, getting to eye and hearing tests, or even just simply going shopping. So what were the technology concerns? Well, older people need training, and this was different in different regions, but certainly people commonly expressed limited access to broadband and the internet. There were also fears about being safe online, And lots of us have heard about the scams against older people taking money out of their bank accounts, etc. And the physical limitations of using technology, poor eyesight and arthritis. And certainly there's a need for appropriate apps which take into account people's age or their language and their health needs. So what were they interested in technology for? Well, a lot of them actually were very interested in social media and communication. They wanted Facebook, but things were needed to be available on a bigger screen, such as TVs. They were also interested in the Internet of Things and automation of household appliances, which many of them understood to be quite useful in terms of physical health problems and growing morbidity. And also, again, very interested in cheap and accessible transport, and certainly wanted help navigating medical and personal care needs. The other things that people were interested in too were initiatives like Place EE that helped enable intergenerational cooperation and to enhance active citizenship. They wanted shared spaces to facilitate connectedness, and certainly more intergenerational activities to develop social networks and relationships, and forums where older and younger people could come together and talk. So what did we achieve? Well, we created social capital through intergenerational exchange. We achieved the improved capacity of older people to engage with new technologies, and we certainly facilitated access to health and social care services. We highlighted and showcased local heritage across remote and rural regions of the EU, and importantly too, especially in a world which seems very divided, we helped to provide links between European citizens. And these were the outputs. A community mapping tool and a process of community mapping. We developed an intergenerational IT kit, which we are able to share online. We did a systematic review of intergenerational skills exchange programs between adolescents and elders. We developed newsletters and widely circulated those. And lastly, of course, as I mentioned earlier, a transnational cultural heritage archive. Okay, so thank you for listening. If I could just introduce Colette Leeson from the Department of Finance in Northern Ireland. And Colette is the Director of Digital NI Enabling Programme. And she's been a great supporter of Place EE and really, really supportive of developing digital technology for the use of older people.
My name is Colette Leeson. I work in the Department of Finance as part of government, and I work in a programme called the Digital NI Enabling Programme. And within our division, which is Digital Shared Services Division, we look after the government's digital transformation strategy. So part of the wider team would be responsible for that. And digital inclusion is one of the elements and the strands of that. So absolutely delighted to share what we're doing. And it's very interesting to hear how it fits in with some of the work you've been doing as well. And we are responsible for making lives better, the government's strategy for digital transformation. I put up the links here for anyone that is interested in the strategy. It runs from 2017 to 2021, and it sets out what the government is doing in relation to digital shared services and to make a number of our government and public services online. And digital inclusion is one of the key elements of that. It's one of the key 9 strands. And one of the key things over the last 6 months in particular is we all know digital inclusion is important. We all know it's very important to particular groups of people who are most risk in society, and older people, people in rural communities, all have particular barriers. But over the last 6 to 8 months, all of us have barriers, whether that's in work, whether that's for your social life, whether it's trying to access services and get yourself heard. It is very, it's a culture shock for all of us. It's a major learning curve for many of us. And I'm no spring chicken myself. A lot of this is new to me. A lot of the work that we're trying to do and how we're getting involved in public life and economic life and social life means that we're having to learn to do it in new ways. And it's uncomfortable. It's not how we're used to doing things. And so for the past few months, we've been working via Zoom and WebEx to have meetings, to talk to our family and friends, and just to order our groceries and engage with society, book our hospital appointments and doctor appointments. And that is having an impact for all of us, but particularly for our older people, because it's putting limitations on how we deal with health and social care services in particular, how we book services online. And it means that for those who are isolated, they miss out on the opportunities for appointments or assessments, and they may become more isolated at home, which can further exacerbate their conditions. So as I say, COVID-19 has had an impact on all of our lives, and I thought I'd put this slide up because this was from 2018, and it's before we even got into COVID territory. And if you can see from this internet use, the older population society, the 55% of 65 years of age or older are using the internet, compared to 98.4% of those aged 16 to 24. So there are more than half that are using it. And I think it's a misconception to think that nobody over 65 is using the internet. A lot of my friends' families would tell you different. But there are, when you look at the stats, there are particular groups of people who we need to concentrate on, particularly during a time like this. For those aged 65 years and older, 100% from professional occupations report to using the internet, compared with people from unskilled occupations. So depending on what exposure you've had to it in the past determines whether you will actually be able to cope and adapt in this climate. And males are more likely to use the internet compared to females. And again, within rural areas, there may be slower broadband, if it's there at all, which can impact on people's ability to actually use services. So I think, more and more of us during COVID are spending more and more time online. But for those that have barriers to using the internet, the chances are they're going to be more digitally excluded over this common period. And I think the key for us in government is that even if we get through this and out the other side, that going back to normal is not necessarily going to mean things as they were. I think the push towards moving more stuff online, doing more services via digital means is going to increase, which means we need to look at how we bring the population with us. Okay. So in terms of barriers, I mentioned barriers. It's certainly access and benefits and services, access and hospital appointments, access and doctor's appointments, and being able to connect with friends and family during this period has been an issue. Remaining connected whenever so many locations remain closed. A number of older people and people with disabilities and people from ethnic minorities would use the local library as their hub. It has free internet. People maybe from particular environments wouldn't have money to put on their mobile phone and get their phone credits or have internet data to use when contacting their healthcare providers and stuff. So again, I think having those places like internet cafes and libraries and youth centres and whatever available in the community at this time, the lack of that has potentially created barriers to people from being able to actually access services. And for those for slower constrained internet connectivity, that mobile only data is going to present problems in terms of internet access, in terms of having the right broadband, or else the use of 3G, 4G, and the cost of that provision over time. So as I say, I think it's around how we manage those barriers and how we work with people. And as I say, I think social isolation is another issue for older people in terms of their health. It may not necessarily just be physical illness, but people have been shielding over the last few months, and we know that things like mental health problems and social disconnection puts older adults at greater risk, especially where maybe they don't have close family members or they're living far away from them. So I think these are all things that we as government services need to bear in mind whenever we're looking at what we do and how we deliver services in the future. So as I say, in terms of understanding the barriers, I think I've covered some of that. It is around actually having the mobility. People with who are from older generations may also have issues. If you've got a disability, you may have issues accessing services. And for some people, it is that fear of the unknown. You don't know what you don't know. And without access to people who can help you and take the fear out of it for you, it can seem like a scary new language and a scary new world to join. And as I say, I think the lady on the right there, what is a dongle? Again, I think there are many of us out there, no matter what age we are, that would have have those sorts of questions in relation to technology. So it is actually having, you know, someone that takes some of that fear away from you. We find that actually brings people to the table when it comes to digital. And that's really what my organisation does, to actually support people who need to use the internet, but also support government agencies that are trying to adapt their services to make them available to people who are who have barriers to using them. So in terms of the team that work within Digital Shared Services, we have a dedicated Department of Finance Digital Inclusion team, and they support delivery of the digital transformation strategy, the government strategy, by delivering a number of projects. They deliver what's called the Go On NI programme, and again, that's the web link to it. And that programme delivers a number of projects across Northern Ireland to help different groups to get online. And I'll mention some of those, and there's links to some of those later on. They also develop strategic partnerships to support difficult to reach groups, particularly in communities where, you know, government can be seen as quite remote and quite sort of far away from what's happening on the ground. So we do work with services, we work with other voluntary and community organisations to try and get down onto the ground to make a difference. We work with the library service, we work with the likes of supporting communities, RNID and Rural Community Network, etc. to actually get down to where people are so that we can actually deliver training that works. And we also, the third prong of our approach is to encourage departments and encourage services who are delivering services to the public to embed digital inclusion at the outset when they're thinking about how they deliver services and deliver their policies. And one of the ones that I've mentioned already is the Go On NI initiative. And again, I think this is one that's available. It's available now even through COVID. And it, as I say, the web links on a lot on there through our NI Direct website, Go On NI. And it is set up really to target harder to reach people, to help them to get online. It's for people who can't or won't engage online. And we work very heavily with the likes, as I say, of libraries, NI, supporting communities and business in the community. To deliver training to people to help them with a number of things. It could be anything from using Facebook to using an iPad to looking at how they keep safe online, etc., etc. So there's a lot of training that goes on. We work with digital volunteers who help deliver that training, and they come from all over Northern Ireland. And our approach really is a partnership model. We, as I say, we'll work with various agencies to try and get onto the ground and deliver those supports. And again, it's not all voluntary services. We work with the likes of Barclays Bank, and we work with the disability groups to actually make sure that we're getting the right people on the ground to deliver. And I suppose what that allows us to do is it allows us to do something that's trusted in the community. We work in libraries, we work, you know, we've delivered in Belfast City Council, in the City Hall, at tea dances and everything. We'll go out anywhere, and we try to come where people feel safe to come so that we can deliver training online. And we do the Silver Surfers Days as well, that many of your audience may well have attended in the past. But it's really trying to encourage people to go online and to work with them so that they feel confident and safe working along with someone. Now that's great whenever we're able to get out there and do that, and whenever our customer base is able to get out there and do that, but at the moment that's not possible. So what we have set up is a new service at this precise moment in time, and it's really to allow people who maybe are at home at the moment and can't get online or have problems or are afraid to get online to actually get involved and to work with a volunteer who will help coach them and support them to get online. So as I say, I think the key thing is that this service has been set up really to assist people who need to complete specific tasks online. And it's a virtual program, and it's called Digital Help. Really, we're working in partnership with business in the community. And just as it says on the bottom right hand side of the screen here, really all you need to do if you need help is either to text digital to 67300, or else call the number 07551 852 684. And again, I suppose one of the key things about us doing it this way and then we ring you back, is that it means that things like telephone calls and the cost of calling and all of that is hopefully not an issue for you. And it means we'll contact you, we'll go through it with you, and we'll put you in touch with the right person to meet the needs. So really, I suppose it's one way of us trying to find some way of engaging at the moment where maybe you can't get out, or maybe some of the services you use are not open at the moment, and it's hopefully we can get enough people out there knowing about this, because it really has the potential to help a lot of people to, to practice and get involved with some of the things that might be online that might remove some of the barriers for people. So as I said, it was one thing I particularly wanted to flag up today. But so as I say, I think that's one thing I would say is there is help out there. If even if you can't use it yourself, even if you take the number and talk to one of your family members, it's something that maybe could start you off on the road to actually addressing some of the barriers. And as I say, I think the key thing for us is to try and remove some of the barriers to getting online. Yes, for some people it will be a skills thing. And just if you've never used it, just like me at the start of this presentation, you don't know how to actually get your presentation up there and running, it'll take you a few minutes. You might feel a bit embarrassed, you might feel a bit concerned, but again, it's trial and error, and the more you use it, the more you get confident. That's what I'm told anyway. But I think the key thing is it's about having the skills and learning the skills and working with someone. And as I say, that's what we do. We get volunteers who work as mentors to help you at your pace to develop your skills. For some people, as I say, 55% have online safety concerns, and again, one of our sessions is on internet security and staying safe online. 75% feel they don't want to, or don't, it's not for them. As I say, I think the key thing at the moment is I think the last 6 months have proved that actually, if anything, the use of online services is probably going to increase as we work with government services. And again, I think one of the key things we want to do is to work in partnership with those services at the outset, so that when they are designing their services, when they're consulting on them, when they're working on their policy, that they start to think about, well, what might the barriers be? Who do we need to go and consult with? What training might we need to do with them up front, so that when we introduce our new service, we can be assured most of the people who might want to use it are in a position that they can. So I suppose really to finish off, I suppose what I wanted to do was actually do a wee bit of advertising for some of the stuff we're doing over the next few months. Again, I think I think the last line there, we are sure we can help. I think the key thing is reach out. We do know that there are lots of opportunities we're putting out there, but it's how do we make sure that those that need them most get them. So what I would do is, anyone listening to this, tell your friends, tell your neighbours about Get Online Week during 19th to 23rd of October, that there will be opportunities for people to learn, to actually get online, to work with a mentor, and that there's free remote support now through the digital help service, free remote support through Zoom digital training through the library service, and free hard copy materials. So there's stuff there. And again, if you don't know how to get it yourself, talk to your families and friends, get them to download it, but start somewhere. And as I say, there's e-learning training again available on our website, and we can deliver bespoke training as required. We're excited about how we can take something that has been a very, very difficult few months and turn it into an opportunity to put some of this at the forefront, to say, right, okay, if we are going to do more stuff online, how do we bring people with us? How do we make sure no one is left behind? And how do we actually work together to make that happen? So yes, very, very, that's why I was very pleased to be part of this. And as I say, I will certainly put my slides up on my Twitter handle. And you've got all the address. My name is Colette Leeson, so just look me up on Twitter. And certainly if there's anything we can do to help, we certainly will. So thank you very much for your time.
And our third speaker is Sylvia McCarthy, Communications and Network Manager for Age Friendly Ireland programme. You're welcome, Sylvia.
Well, hi, my name is Sylvia McCarthy, and I'm working with Age Friendly Ireland. I've been with the Age Friendly Ireland as Communications Manager. I've been with the programme for the last 10 to 12 years. So I just want to give you a little bit of sort of information about the programme itself, and then perhaps some of the ways that we've, I suppose, in one sense reacted, or what we have done in response to the COVID pandemic and how it has affected older people within our network. So I'm just going to, I suppose, start out by telling you that Age Friendly Ireland is a shared service of local government. We actually provide technical support to the 31 local authority programmes around Ireland. And just to give you a very brief sort of overview of our past, where we came from, how we started. I suppose back in 2008, 2009, we adopted the World Health Organization's framework for developing age-friendly communities. And the first age-friendly county, County Louth, was established back in 2008, 2009, and they developed their first age-friendly strategy. So what we looked at then was we looked at developing a methodology so that we could scale this program up and get it into basically into every local authority area within Ireland. So we spent some time, a couple of years, really working hard to scale up that program. And then by 2016, 2015, 2016, we got the age-friendly program into every local authority in Ireland. During that time then, we also had the signing of the Dublin Declaration, so where all local authorities signed up, and politically they signed up to making their cities, counties and communities age-friendly. So then when we had scaled up the programme, then it meant that we needed to move on to the next stage, which was embedding it in local government. And in 2017, our programme was brought into Meath County Council as a shared service of local government. And then in 2019, we very proudly met a key milestone where we were the first country in the world to actually be fully signed up or fully affiliated to the World Health Organization's global network of age-friendly cities and communities. And we had a fantastic celebration last November with the World Health Organization, where they formally recognised Ireland as fully affiliated to the WHO GNAFCC. So just to give you sort of an overview of the structure, I won't go into too much detail here, but basically what this is telling us is that in every local authority there's an age-friendly programme, and every local authority has an age-friendly strategy in order to make their city, county, community more age-friendly, and committing to that. And at a local level, it's, I suppose, it's managed and guided by an age-friendly alliance. And that age-friendly alliance is a multi-agency, multi-stakeholder group, and it's made up of our health service, members from, and they would be senior members of our health service executive, our transport, our policing organisation, university partnerships, voluntary organisations, and most importantly, our Older Persons Council has a rep at that table, if you like. So normally that group is chaired by the local authority chief executive, and on the ground locally it's managed and coordinated by an age-friendly programme manager who's positioned within the local authority. And then, as I mentioned there, the Older People's Councils, there's 31 Older People's Councils around Ireland, and they're key, they're the voice, that this is where the voice of the older person is brought to the table. They bring the issues to the Alliance, but more importantly, they're part of the solution. They help to solution those issues. Also in the local authorities then, in the last year, we now have an age-friendly housing specialist. So that housing specialist is there within the local authority, and they're available to guide people, whether it's a local person looking to adapt their house or make it more age friendly, or perhaps it could be a private developer who's looking to develop their land. So that's really at a local level, and then we're governed at a national level by a national advisory group, which is made up of local authority chief executives, 4 assistant secs from our government departments, our health service national director, and an assistant commissioner from the Guards, and then the CEO of Chambers Ireland, which represents our business community. And where, I suppose, where our governance comes in as well, if an issue is brought up at local level and it can't be solutioned at local level, it doesn't mean that the problem stops there. We have the mechanism there to escalate it to our national advisory group and get national advice and solution it nationally. So that just gives you an idea of the structure. So I suppose going back to the older person, our Older People's Council and the voice of the older person, I suppose during the pandemic, their voice has become more important now than ever before. The older people, as we can well imagine, are particularly vulnerable to COVID. And Age Friendly Ireland, as a representative voice for those older people, we find now our work is escalating. We're particularly busy, but we are in a position, as I mentioned, to escalate any issues that are brought to us by older people through the Older People's Council, and try to get those issues relating to COVID solutioned at national level. So just, to run through, there's been a wide range of innovative responses to the pandemic, and they've been taking place all over Ireland. Just to give you an example, some of those are community response helplines, information supports, managing COVID call centres, health and well-being activities. The communications care packs have gone out to thousands of people who are cocooning and isolated around Ireland. So basically it was just giving them a pack to keep them going. It could be anything from the words of songs that they know to puzzles. And what we also did is that we put together a national repository where we've sort of gathered all those learnings so that we can share them and hopefully facilitate the scaling up and replication of some of these initiatives. And young people in Donegal, there's a fantastic intergenerational age-friendly choir, Ceola Céile, and they managed to come together on Zoom, and they, during May, which is Bealtaine, month of May, especially for older people, they did a fantastic age-friendly virtual dusk chorus, if you like, where they all came together and sang on Zoom. So that was a fantastic initiative, bringing the young and old together. And apparently just from that choir, there are people in that choir who are new to the country, young people who are only new to the country, and then there are older people who have some mental health issues. So they've really found the whole singing and the choir fantastic. So it was great to be able to continue that, albeit via Zoom, during the pandemic. Just like that, another thing we've done, we still meet our older people's councils, and our programme managers around the country have been fantastic, where they've helped our members of our older people's councils to get online. They never used Zoom before. They were used to going into a room and meeting us. So all of a sudden, in order to keep working, we needed to get them online, which is through the help, as I say, of our local programme managers. We kept that going, our meetings. Another thing I'll tell you briefly about is our libraries around Ireland have also been critical during the pandemic. They've gone out and they've they've delivered books to people who are cocooning. They've gone out, they've gotten help from all different agencies to help them deliver those books. But there was a growing need that we knew that people needed to get online, because if we were going to face into the winter where maybe older people might have to cocoon again, or they mightn't be able to get out, we wanted them to be able to get their books, to go online. So we got together with the libraries, and we're in the middle of doing a pilot with them. And it's a peer-to-peer support where we have trained up a number of older people from our Older People's Council. And, you know, it wasn't easy for them, because they had to not only learn how to get online, but they had to learn about all the different platforms that are available out there and how to bring various platforms together, and to be able to go then and teach other older people how to get online. And that could be just a person who has a phone, a smartphone, and a landline. And it's about helping them to, you know, with patience, to get them online and to get them onto BorrowBox, so that they can borrow their books and different things like that. And we already have up to 40 people within a week who have come back to us and said, older people have said, I'd really love to learn. I really want to get online. Can you help me do that? So what we've done then is that we're hoping to be able to get all our age-friendly champions from the libraries to maybe take the training as well, and to also deliver it to older people, and to get as many people online, because if they can borrow books online, they can do lots of other stuff. So another you know, pilot that we're in the middle of, I suppose, at the moment, which is going to become more, I suppose, critical during, if, you know, if we're going to need older people to remain in their homes, we need to be able to look after them from a health perspective as well. So a very interesting pilot we're running, a telehealthcare pilot, we're running with the Age Friendly programme in Wexford, Wexford County Council, a company called Tunstall, and Waterford Institute Technology. So what we're looking at doing is establishing a POC, a proof of concept for remote patient monitoring. So what we needed to do was we were going to look at 3 identified chronic health condition types, for example, heart failure, diabetes, perhaps asthma. And during this pilot will go on for an 8-week duration. And we'll get a number of people on board with the pilot who have these conditions, who agree to take part in the pilot. We'll evaluate, at the end, we'll evaluate the findings and present this at national level to our national advisory group. That's our governance group I spoke about earlier. With then giving it the potential then to maybe scaling it up nationally. So to just give you a brief sort of overview of what that entails is, we have a patient app. Each patient will receive this app on their phone. So, and by using that patient app, we're able to collect data from these monitoring devices, if you like, check their pulse, for example, their oxygen levels, their blood pressure. And it's a 2-way messaging service, if you like. And there'll be health questionnaires on it. We'll have tailored monitoring results as well. But it's basically the patient is in their home, and through this device, the information is being transported to the clinician at the other end. And at the other end, I suppose, we have a clinical management system. And using this system or this software platform, it allows the clinician and the service teams to monitor the patient remotely. they'll get visual alerts, which is a sort of a traffic light system according to the risk, whether it's high risk, low risk, you know, and they'll be able to easily identify where a patient maybe needs help or they need to escalate the situation. So this, as I say, there's tailored monitoring plans, and the clinician can also contact the patient directly if needs be. They get various reports out of it, which they can use in trend graphs. So I suppose through this telehealthcare pilot, what we will look at is, first of all, I suppose, how older people adapt to the technology, which is very important. We need to make sure that they're comfortable, it's user-friendly, that they're easily able to understand what they need to do. It'll also, we'll look at how assisted technology can support older people to remain at home. And by doing that, I suppose, reducing the need for repeat hospital admissions, which is very important, and then also to reduce the average stay in hospital. So hopefully they're able to get back home, get back into their community where it's known that they, you know, the person gets better a lot quicker if they're allowed to go home and into their own environment. So hopefully to be able to monitor them at home, it'll reduce their stay in hospital. It'll help to increase self-management of chronic diseases. And then also by, I suppose, doing this pilot, we're listening to older people's experiences. And this in turn can help inform future service plans. So I suppose this telecare pilot will enable proactive, preventative, and person-centered care by combining software, hardware, and pathway redesign and support individuals. So that's really our healthcare pilot in Wexford, which we will be, we're sort of at the beginning stages, but we hope to have that underway over the next couple of weeks. But if you go to our website, we've developed a new website. It's really designed with the older person in mind, but then if you design for the older person, as Glenn Miller says, you design for everybody. And that's not the musician, by the way, Glenn Miller. But our website is there. There's information on it. We're still building it, but you'll find a lot of our information on it. And one thing with Age Friendly Ireland is we love to share our learnings and we love to learn from others. So if you want to get more information about any of our initiatives or anything I've spoken about, do please contact me. It's smccarthy@meathcoco.ie, and I'd be delighted to share any of our findings with you.
Thank you very much to all our speakers. Thank you to those who are listening to this broadcast. We hope you found it interesting and informative. We've certainly learned a lot. Thank you very much indeed.